My name is Emma Horst-Martz. I use she, her pronouns, and I am the organizing manager for Planned Parenthood South Atlantic and Planned Parenthood Vote South Atlantic here in North Carolina. If we could go to the next slide. Thank you. I first want to say, of course, thank you to everyone who helped make today happen. I've been watching an impressive group of women work together for months now. And it's also really nice to see so many familiar faces in the room. And my last acknowledgement is just towards Dr. Bryant and Tara. When I moved to North Carolina a few years ago, I wasn't planning to stay. I was here working with family, and I started falling in love with the state, and Roe had recently been overturned, and I was thinking about getting back into reproductive rights work, and wanted to talk to a couple of folks about what that would look like here in North Carolina. So Dr. Bryant was one of my first coffee chats, and Tara was another, and here I am doing my dream job, and have been able to work with so many incredible people across the state, including the two of them. So thank you, Dr. Bryant and Tara, for helping to recruit me to stay in North Carolina. Okay, next slide. So I'm gonna talk a little bit about Planned Parenthood, and then get into some of the funding issues that we face. Just to juxtapose everything we heard about CPCs, or anti-abortion centers, as we in organizing call them. And just a disclaimer, our marketing department did a photo shoot to renew some of our materials, and they used myself and some colleagues as models, so that's why I'm in a lot of these photos. I did not choose them intentionally. So, Planned Parenthood, you're familiar, but we provide a wide range of services, everything from primary care to abortion care to what we call family planning, which means things like STI testing, cancer screenings, birth control, and we serve people of all genders, women, men, and we do a significant amount of gender-affirming care as well for people across the gender spectrum. So next slide. So Planned Parenthood is broken up in a couple different ways, and I know this can be confusing to follow. There's Planned Parenthood Federation of America, which does the national advocacy and legislative and judicial work, but they don't provide healthcare services. And then there are affiliates across the country that run the local health centers. So we are Planned Parenthood South Atlantic. We cover North Carolina, South Carolina, West Virginia, and the western part of Virginia, which is really critical when there are patients that come to us who are further in their pregnancy than what they can get abortion care for in North Carolina. So then we work really closely with the health centers in Virginia to send them up and provide care. The pink stars on the map are the locations where abortion services are provided. And I'll note that here in North Carolina, we've gotten to a really incredible place where Raleigh is actually the only health center that doesn't provide any abortion services. So we have a good amount of coverage in the state. And there's also telehealth. Next slide. So this past year, we served over 60,000 patients. And since the fall of Roe, our patient navigation program has helped more than 8,000 people access abortion care. So the patient navigators on our staff are really incredible. When people call into the health centers or have an appointment and need logistical help figuring out like timing of their pregnancy or what their options are, where they can go if they're traveling from Florida or Texas or Tennessee or wherever else, the patient navigators walk them through that process of figuring out which health center to make an appointment at, like where they can get in with the right timing. They help them figure out how to get funding for a bus ticket or gas to drive up or childcare for while they're gone. They do a lot of that work with folks, so that's a relatively unique part of our program. And the Carolina Abortion Fund also does a lot of this work, so we partner with them as well. Next slide. I just wanted to mention, I'm not here in this capacity today, but I also work with Planned Parenthood Vote South Atlantic, which is the advocacy wing of our organization. We do legislative advocacy, working with people like Representative Von Haven, mostly to stop the bad bills, but also to help support the positive bills that are being introduced. And then we also do a lot of electoral work, making sure that we elect candidates who will support reproductive freedom. Next slide. So I just wanted to counterbalance the approach that CPCs take in their misleading patients and lying and posing as if they're there to help people and actually making their lives much worse. Our values at Planned Parenthood are to provide safe, non-judgmental care no matter where people are in their healthcare journey or their personal feelings about their health status. And this is really the value that leads everything that we do. So unlike what the anti-abortion propaganda machine would say, the providers are never there to convince anyone to do anything. It's really to listen, be supportive, talk about options, and then just provide the highest quality health care possible. So in terms of services, I mentioned this, and just remember what the CPCs are claiming to provide, and then this is what a legitimate healthcare center would actually provide. We can go to the next slide. And then just to give a baseline understanding of what abortion care actually is, there's two primary ways that we provide abortion at Planned Parenthood. The first is medication abortion, which is typically a set of two types of medication. The first is mifepristone, and then the second set of pills is misoprostol. It's incredibly safe. It's super common. This is what you would take if you're ordering abortion pills like through the mail or through an underground network. And it's recommended to use before 11 weeks of pregnancy. And then the second type of abortion care at Planned Parenthood is in-clinic or procedural abortion. This is typically a small device that applies gentle suction to empty the pregnancy from the uterus. And it's very quick and typically a very smooth process experience. And I think people are often intimidated by that because it's something happening in the clinic. You're like sitting on the doctor's office table. There are all these ideas or images that are conjured up in the media about what that experience can be. But for many people, it's actually smoother and more comfortable than taking abortion pills. And that process, is completed at home and includes a lot of cramping and discomfort. So both are really important options, but I think it's important for patients to understand what the experience might be like, and that's part of what the providers talk through with folks as they're making decisions about what kind of healthcare is best for them. So we can go to the next slide. Abortion is incredibly common. 1 in 4 women will have an abortion at some point in their lifetime. And people, all different kinds of people have abortions. It's not like a specific subset of our communities. Over 60% of people who are having abortions already have at least one child. So the most common reason people get an abortion is related to finances and whether they feel like they can afford to grow their family or have more kids. It is incredibly regulated. Here in North Carolina, we now have a ban after 12 weeks of pregnancy. Most people figure out that they're pregnant sometime around 6.5 weeks, or 5.5 weeks, somewhere in there. So it's not a lot of time to think about what you want to do, find an available appointment, and then get through all the hoops you have to jump through to actually access that care. And then it can be easier to access medication abortion, but again, it just depends on the state. And even here in North Carolina, there's a 72-hour waiting period. So you have to come in for an appointment, go through that counseling process that Dr. Bryant mentioned, which is a script written by state legislators and not by healthcare professionals. You have to sign a stack of paperwork. I believe it's something like 60 places where you have to initial, and you're being read this like misleading, slightly upsetting, confusing information the whole time, and staff hate doing it because it's not fair to the patients. And then you have to wait 72 hours to either have your procedure or get access to the medication. And of course, it's stigmatized. There's still a lot of shame and hard feelings and misunderstanding around something that is so common and so normal. Okay, so how are people supposed to financially access reproductive care? And what does that actually look like in reality? So before we move into the threats towards the Medicaid program and patients seeking to use it at Planned Parenthood South Atlantic, I wanted to give a brief explanation of what Medicaid actually is and why it's so essential in the American healthcare system. And before I dive into this, I just want to clarify, it's a little bit of a jump from talking about abortion care to Medicaid. Public funding or federal funding cannot be used to pay for abortion services. So people typically have to pay out of pocket for an abortion, and it can be more than $600, even for the medication. So there was a policy called the Hyde Amendment, which was passed a long time ago, but that prevents any public dollars from being used for abortion care. So that is one big misconception. And what we're talking about now, accessing reproductive health care, this is all of the other preventative care, family planning, cancer screenings, primary care. So Medicaid is a joint federal and state healthcare program that helps cover medical costs for people and families with limited income and resources, including children, people who are pregnant, elderly people with certain incomes, and people with disabilities. 1 in 5 Americans nationwide use Medicaid, and it covers 40% of all children, 40% of all births, 60% of nursing home residents, and 44% of adults with disabilities. Most relevant to Planned Parenthood health services, Medicaid also covers 75% of all family planning services provided across the country. So those are the services I just mentioned. Next slide. Zooming in for a moment, I wanted to highlight Medicaid coverage in our service area. So all of our states, North Carolina, South Carolina, West Virginia, and Virginia, have a large percentage of the population who rely on Medicaid for access to affordable health care. Those states, including South Carolina, those states with the asterisk on the map, are the 10 remaining states that have not expanded Medicaid. So that leaves thousands of people who can't afford private health care plans without access to care. Next slide. And then in our affiliate, prior to recent legislative changes, approximately 13% of PPSAT's patients in 2025 were folks who relied on Medicaid to access care with us. You'll note that this percentage is comparatively small compared to the national Planned Parenthood average, which is around 50%. And this can be attributed to how the states we serve invest in public health infrastructure. Because Medicaid is a jointly funded program between federal and state governments, states have a degree of flexibility about what populations and services they choose to cover, how to deliver care, and how much to reimburse providers, causing significant variation in program spending and the share of state residents covered by the program, even within states that have expanded Medicaid. Next slide. I wanted to talk about Title X because this is another really important funding avenue for patients to be able to access care. Title X is the only federal program dedicated to affordable birth control and reproductive health care. Since the program started in 1970, it has garnered broad bipartisan support year after year. It's meant to ensure that every person, regardless of where they live or how much money they make, their background, whether or not they have health insurance, has access to basic preventative reproductive health care like birth control, cancer screenings, STI testing, and general well woman visits. It's an important safety net for people who would otherwise go without this kind of health care, and includes communities of color and people with low incomes, two groups who historically face significantly more barriers to accessing healthcare in general, especially reproductive healthcare. So lastly, moving into, I guess I should mention before we move on to federal attacks, related to federal attacks, the status of Title X funding is very much in flux right now. The Trump administration actually took it away, and there have been many different court cases moving through the process. So it is temporarily restored in some places, and patients are able to use it at most of our health centers. But again, it's in flux. That could change tomorrow. This is just the world we live in at Planned Parenthood. So our last big section is the attacks that we've seen to the Medicaid program this past year through HR 1, the big beautiful bill. Part of that was directly cutting Medicaid and SNAP funding, of course, but then the other piece of it, which affects us directly, is that there was a policy included in that bill package that basically cut Planned Parenthood and abortion providers like us out of the Medicaid program. But the way that happens in practice is that patients who have Medicaid as their health insurance can't access services at Planned Parenthood. So it was meant to be a political attack on us as an organization but it really directly affects the patients themselves. And remember, like, most healthcare centers only take maybe 5% of their patients who have Medicaid. So, and Planned Parenthood across the country takes 50%. So there just aren't enough health providers who are able to absorb all of those patients. So that means wait times go up for people who have Medicaid, or they're just not gonna be able to access healthcare, or have to figure out how to pay for it out of pocket. So it's pretty devastating. And then lastly, sorry, next. Okay, so this is about the federal problem. And then the next slide. Of course, the North Carolina General Assembly wanted to piggyback on that approach from the Trump administration, and this past fall introduced 2 pieces of legislation that would make this policy permanent, even if a court case changes the status at the federal level, or when the policy expires in a year, it could always be renewed, but they want to keep patients from accessing Planned Parenthood for those preventative, like, general services indefinitely. So it's passed their first chambers. We're making sure that it doesn't pass the next set of changes here in North Carolina. Yeah. And then if you want to go to the last slide. We also have a petition on our Planned Parenthood table in the other room. We're able to send a message to your state legislators here in North Carolina, asking them not to support this policy to keep Medicaid patients from accessing care at Planned Parenthood. So if you're interested in signing that, it's on our table in the back. Thanks.
Okay, hi everybody. My name is Casey, and I am the Director of Client Services for Carolina Abortion Fund. And I was really going to do a little bit of expansion, more than a question, about some of our services that we provide to Planned Parenthood and abortion seekers in our state. Just as super relevant to what Emma shared with us, we know that Medicaid does not cover abortion services in North or South Carolina. That's where we come in, okay? Abortion seekers in both North and South Carolina can call our helpline with an appointment, if they have an appointment at a Planned Parenthood or at an independent clinic in North or South Carolina. There's not really many independent clinics in South Carolina, actually, but independent in North Carolina, they can call our helpline with that information, and we don't have any sort of like qualifications, anything like that. Call us, express the need for help, and we will provide financial support to abortion seekers in North and South Carolina. We work very, very closely with those patient navigators that Emma stated, and we work directly in contact with them to get these costs, these $600 costs, as low as possible for people. So I definitely appreciate everything that Emma shared with us today about Medicaid and those state resources, but I also wanted to share that there are options available for abortion seekers in South Carolina. Thank you.
Okay, let's go over here.
Hi, I'm Becky, and I don't know if this is for Emma or Amy, but can providers do any kind of disclaimer before they have to go into all that paperwork and script that says, I'm sorry, I have to do, I mean, whatever the disclaimer would be, but can we do that? Can you all do that, I mean?
Amy, you should answer.
Yes, we can, because we have free speech rights also, and I will often say, like, you know, I have to tell a patient, like one part I didn't go into is you have to tell the patients, you know, you are attesting that I haven't coerced you or like forced you in any way to have this abortion, and then the next line is, and you have the right to sue me. And again, we have to give the website of where they can sue us. So we always get a laugh out of that, and patients understand that. Yeah.
All right, our next question. So am I understanding the bottom line, I'm looking for clarification, that these CPCs will get $18, $20 million, Planned Parenthood are getting nothing or very little, and a lot of public funding, donation has to go to this organization. Is that what I'm understanding?
Yes. So Medicaid, which is, tax funded, reimburses a health center for the cost of serving that patient. So it's not like a blank check that's put into a budget for an organization or a health center to use. It's simply like an insurance reimbursement, like any other insurance program. It's just that the taxpayers, fund that program. So Planned Parenthood does not get like state funding or federal funding the way that crisis pregnancy centers do. And I also understand that Carolina Abortion Fund relies on donations, and they don't get enough donations to cover patients for the entire month. So when the funding runs out, it's heartbreaking, and there's nothing we can do. Like, it's just done. So they can't serve patients, or they can't provide funding to patients for the rest of the month. So please donate to Carolina Abortion Fund.
Who has a question? Oh, right here.
Yeah, these are questions about financial sustainability.
Would you stand up, please, so that I think people would like to see you?
Hi,
Thanks.
yes, my name's Christina Fowler. Yeah, I had some questions about financial sustainability of Planned Parenthood. I just wanted to know what percentage of your clients had private health insurance, and how successful Planned Parenthood has been getting into some of the private insurance networks for care.
Dr. Bryant, do you know anything about this? Because I don't.
I have a contract with Planned Parenthood, and I provide abortions there. So I don't know enough about the insurance side. I do know that that we can't bill Medicaid for abortion, obviously, and there are some other health plans that Planned Parenthood will accept. But in the places where they do abortion, they will not accept Medicaid.
Other questions? Right there.
I was a little confused about the role of Medicaid in North Carolina. I understand they can't pay for abortions, but can Medicaid patients access primary care and other services?
No.
And also, if you would, again, explain what the legislation is pending in North Carolina that we might want to let our legislators know about.
Yeah, so just to clarify, because of the policies that were included in H.R. 1, the federal reconciliation package, Big Beautiful Bill, this past summer, basically health centers that provide abortion can no longer take patients with Medicaid as their health insurance. And it's a political punishment from the Trump administration and the federal government. So that means that if you are a patient who has Medicaid as your health insurance, you cannot get like primary care services or cancer screenings or STI testing or birth control at Planned Parenthood using that health insurance. And the state legislature here in North Carolina introduced they rewrote 2 pieces of legislation that had already been introduced. That process is called PCS. It's like very complicated, but basically they rewrote these bills that were meant to be about education funding in the state to then say Planned Parenthood cannot take Medicaid from patients indefinitely in North Carolina. So they want the federal policy to be applied permanently in our state. It hasn't passed to the governor's desk yet, but they could pick it up again when session starts in April, because it's made it halfway through the process. So that's what the petition is related to. Yeah. Yeah, there are two bills, and each one passed their originating chambers but have not been picked up by the opposing chamber, which is part of the drama that we have in not having a state budget, and like nothing is passing right now because leadership is infighting.
This is going to be our next to last question, or next to last comment.
I'm Felix. I'm with Interfaith Voices for Reproductive Freedom. Oh, sorry. I'm Felix. I'm with Interfaith Voices for Reproductive Freedom. But I wanted to add, and I think Tara would be the one to mention this if she were here, or Representative Van Hoffen if they were still here. I mean, if she was still here. But I do know that there is a plan from the PLI handbook policy that they want to put out in April that is about challenging state funding of CPCs. So just be signed up for the different networks that are here, and you'll get info on that. So I think like speaking out against those bills and speaking for that bill that Representative Van Hoffen's going to put forth would be meaningful forward actions to give hope amongst all the frustration.
Okay.